Some of our fears around the dentist go way back, but new approaches to modern dentistry emphasize comfort and calm, transforming a stressful encounter into one of relaxation and trust. Today, we're exploring this reimagined patient experience with a local cosmetic dentist who is redefining what it means to care for your smile. Let's welcome cosmetic dentist Dr. Andrea Joy Smith. Good to have you, Dr. Smith.
Thank you so much, Desiree. I'm so happy to be here.
Yes, okay, so Dr. Smith, as our dentist, if a missing tooth is making someone hesitant to smile, which is understandable, how do implants step in to restore what was lost?
Yeah, implants step in to replace that tooth. The implant itself, which is a titanium screw like device, and that serves as the root of the tooth. And then a pearly white glowing crown can be placed to replace the tooth itself.
And I could see how getting that tooth replaced, it builds that confidence. And some of our viewers do wear dentures, so how can implant technology provide a more secure and comfortable solution for them?
Yeah, one piece dental implant technology has definitely provided a great, less expensive, less invasive procedure for that. The procedure that we do is what we call flapless, which means that we don't have to cut your gums. We place the implants directly through the tissue after, of course, getting you numb. And then we use your same denture to fit over the implants. And as a result, that denture can now snap in place and give you the confidence to go out to eat with your friends and family, to smile without worrying about your denture slipping.
There you go. They can enjoy some corn on the cob. And Dr. Smith, how do you help someone figure out if they're even a good candidate for this procedure?
Yes, in our office, we offer a complimentary consultation. The patient comes in and we take what's called a CT, which is a cone beam CT. And what that does is allows us to see the bone in 3 dimensions. And for a patient that is recently missing a tooth, there's usually adequate bone for us to replace that tooth with an implant. And so we figure that out by looking at the bone in 3 dimensions with a CT scan.
And can you walk our viewers through the one-piece implant process?
Absolutely. Two-piece implants have really dominated the market for quite some time, and they have actually served our dental community quite well. But over the last 20, 25 years, the one-piece implant has gained in popularity. And so, whereas the two-piece implant required 2 different surgeries, 2 different appointments, and sometimes up to 3, the one-piece implant has allowed us to place the implant and to place a temporary crown on the same day. Traditionally, conventional implants are actually inserted and buried under the tissue for several months, unable to use it at that time. But with the one piece implant, we have the implant and also the part of the implant that holds onto the crown, it's installed at the exact same time. Now, we do give our patients instructions, no eating hard things, stick to a soft food diet. We give them very careful instructions, but cosmetically, that tooth can be added the very same day.
Dr. Andrea, from the first phone call to the final checkup, what does it feel like to be cared for on this journey? Because earlier I had mentioned people have fears of going into the dentist's office, whether it's from years ago or hearing horror stories. So how do you help put them at ease?
In our office, we offer sedation dentistry. But before we get to that, we actually have that patient come into the office and we pretty much meet them where they are. We sit down and we speak to them eye to eye. We figure out the genesis of their fears. Where did that fear actually come from? And we do our best to let them know that here under sedation dentistry, you will be extremely comfortable during the visit, as well as the visit will be completed and you'll really have no memory of it when you wake up. And so once we speak to them, meet them face to face, and explain that sedation process to them, they're usually really comfortable. And I hear from them a lot. I just remember walking in, and then the next thing you know, I woke up at home in my bed. And when I looked in the mirror, I had a tooth. So we can actually allay those fears by explaining our sedation process, then performing the sedation process, and then allowing them to have that smile or tooth
Yeah.
restored without any fear or anxiety.
I can imagine that makes all the difference. Dr. Smith, always making sure we smile again now. Thank you for joining us. And to our viewers, a brand new smile can have you grinning from ear to ear. Learn more by heading to smileagainnow.com. or call 916 482 8300.